I honestly think that they would say that I listen, and I hear it a lot. I think just the way being a doctor has gotten over the last 20 years, there's not a lot of time. And so to be able to take that extra minute to just hear what a patient has to say, I think they would say that I'm a pretty good listener. And so building that trust takes a while to get to know somebody, so that when I give them a recommendation, they go, okay, yeah, I'm gonna follow that because I know he's got my best interest at heart. And that, you can hit it right off the bat with a patient, or it can take months or years to do that. But I think that the listening, the interpersonal relationship is the foundation for the trust that you need to take care of people. Wow, the most rewarding part of my job, I always kind of joke that the medicine's gotten so complicated. There's so many insurance things, there's so many stuff that happens between patients. But after all these years of doing this job, I still like the interaction with the patient. You go in, you close the door, you sit with the patient, and it's great. It still is after all these years, which is almost 20. Everything else is kind of crazy, but that is still the most rewarding part, when you actually walk out and feel like you've done something. We're kind of wrapped up in all the same sentiments, that when you find the diagnosis, sometimes it's so obscure, so difficult, and you fix the problem. We do a lot of preventative stuff, which is great too, of trying to make people not sick in the first place. But when they are sick and you can figure it out, it's still a mystery, still a puzzle game after all these years of experience. But that is a experience I don't think you can get in many places. Primary care still is everybody. It's all ages. We still see newborns. We still see, my oldest patient was 102 and a half. And everything in between. We are trained to take care of literally everybody. And that, I had a family of 5 generations that I saw somebody at every generation at one time. And it was again, probably talk about rewarding, one of the greatest things to know that all those generations of folks would trust me with their care. So I'd want people to remember that family practice, we do it all. We literally see everybody, everything.